Okay, so the recording has started, and I want to thank everyone who joined today or tonight at our presentation for medical food nutrition insurance coverage for homocystinuria, HCU. Thank you so much for joining, and I believe Francis is there, and thank you so much for joining. I will be working with you tomorrow. Okay. I plan on it. As you can see, I'm trying to gather everything here together. We'll help Jason. Trust me, I'm going to help Jason. So anyhow, we'll move forward with that. Let's see. First, does everyone have this presentation on their computer screen? Yes? No? No?
No.
Yep. Okay. Well, some do and some don't. Okay. So I'll just try to go through as slowly as I can, I guess. And if you have any questions, please feel free to go ahead and jump in. If you need to mute me for some reason, you have someone talking in the background, feel free to go ahead and do that. Just before I start, Danae, are you there? Yes or no? Okay. All right. So I'm going to go ahead and go. I can't hear.
Yep, I'm here. Go ahead and go. Thank you.
Okay. So, again, I'm Raenette Franco, founder of Compassion Works Medical, and I consider myself your rescue for coverage. Those who know me knows how I work and the experience that I've obtained just working over several years with different or various insurance companies and working with different types of medical conditions, but we just want to focus today on HCU. So we're going to talk about coverage for HCU and related comorbidities, insurance terminology, the difference between medical and pharmacy coverage, products covered for HCU dietary treatments, reimbursement issues between insurance company and supplier, billing discrepancies, verifying insurance benefits before placing an order, medical food exclusion removal, Medicare and Medicaid advice, and of course, if you have any questions and at the end, we'll be happy to support that. All right. So just so you know, I'm a little new to the HCU chapter. I'm typically used to PKU or another type of rare genetic disease, so I'm still learning the differences and the dietary treatments with HCU, and there's classical, and there's all different types of disorders, which is the classical CBS, the cobalamin defects, and the MTHFR defect. So these are something totally new to me that I'm learning, in which just working on with hands-on experience, learning how to get certain things covered that are related to HCU. I'm just going to say HCU as a primary diagnosis. So comorbidities is a medical term used to describe an additional disease or diseases or disorders co-occurring with, that is, concomitant with concurrent a primary disease or disorder such as HCU. Okay, so if you have your primary diagnosis is HCU, but you have a condition that's related to that, and it's being billed as on a medical claim that the primary diagnosis is HCU, the second service would be whatever the other disorder or the related disorder would be on a claim form. That's how that would look like. Again, if HCU is the primary diagnosis and there are additional medical treatments required to maintain a person's health, that is in relation to treating HCU, then the treatment should be covered with a prescription, of course. Coverage for HCU and related comorbidities, treatments for the primary diagnosis of HCU is an ICD-10 code, which is E72.11, and this should be covered under insurance with a prescription. So again, you have different types of HCU, which is the classical homocystinuria, the cobalamin defects, and the MTHFR with high levels of HCU. The medication treatment for the classical homocystinuria is B6, B12, folic acid, cysteine, formula, low-protein diet. The cobalamin defects are usually the B12, hydrocobalamin injectable form, cystidane, and some may be prescribed a low-protein diet and formula, it depends, or folate or levocarcinate. If I'm saying this wrong, please help me out here, okay? And the medication treatment, again, I'm not a nurse or a doctor or anything. This is just something I'm learning as well, so I can help you or your loved ones get covered for these products to help you afford and maintain your dietary management. And then for the MTHFRs, consume more natural folate, vitamin B6, and vitamin B12, not folic acid, which is synthetic vitamin B9, a folate-rich diet, and some clinics may suggest special diet. All right, so we're here at insurance terminology, or I should say medical billing. Okay. Without knowing the proper insurance terminology, understanding your insurance coverage for medical foods and enteral formula can be confusing and frustrating. This is the number one issue that we have around the world, is the difference between the terminologies. You have the technical aspect and you have the insurance medical billing aspect terminology. And so sometimes politicians, they just look at what's in the books, but they don't look at or can't see what's really behind the screens. And the only people that can really see behind the screens is usually a medical biller or an insurance specialist that works on a daily basis with insurance verification and medical billing. So let's start here. Understanding your insurance coverage and policy. What is credible coverage? It's also known as health benefit plan. Credible health coverage is your policy from your employer or any other party that provides policy guidance and benefit information, including whether it's insured or self-insured. Again, this is something that you would need to discuss with your human resource department. They have the insurance adjuster there, and if you have any questions about your plan, that I suggest that you go speak with your human resource department. And okay, so then you would read through your credible coverage policy. When you have that, your summary benefits, for an accurate description of medical food formula benefits. So you have to go through that policy and see if they have it in writing for medical food, formula, dietary supplements, like looking for those words, and checking to see if there's any exclusions under that particular area before calling your insurance carrier for questions. Okay, so again, the key words are enteral, medical foods, nutrition, formula. That's what you're looking for in your benefit summary. The HCPCS codes, which are also service codes used to bill for this, are usually B codes, and then there's 2 S codes. The B codes are listed here, B4155, B4157, B4162, B9998. Then you have S9435 and S9434. S9434 is solely a service code used for solid low-protein foods. I say PKU foods here, but it's also used for HCU or any other condition that requires solid low-protein foods. The S9435 is a straight service code for medical foods for inborn errors of metabolism disease, which means that it could also be used for solid low-protein foods as well. And then we just learned about a J code, and that's for the injection of vitamin B12. And that code is J3420. So if you or your loved one requires an injection of vitamin B12, it would be covered under your medical policy using the J code, 3420. We'll get into that more with the next slides. Okay, so in-network. These are just basic insurance words. You've probably heard of this before. Again, I'm not an insurance adjuster, but this is just something that you need to understand when you're interacting with your insurance benefits specialist. So you have an in-network, which are providers that participate with your plan, like your doctors, your pharmacies, your DME companies. Same thing as out-of-network. There are providers that do not participate with your plan. And of course, staying inside your network means smaller copays and full coverage. If you choose to go outside your network, you'll have higher out-of-pocket costs, and not all services may be covered. We'll continue. Then you have insurance words, which are medical foods and enteral formula. Okay, medical foods is described in the code S9435. Like I said, that code is medical foods for inborn errors of metabolism disease. It's S9435. Okay, and the enteral formula, that code is usually for a B4157, which it first states enteral formula, then nutritionally complete for special metabolic needs. Okay, so in the eyes of a medical biller and insurance person, they would understand this as an enteral formula, but also it says that it may be administered through an enteral feeding tube, or if it's being fed orally, the medical biller would use a modifier, and that modifier code is BO. So when you're billing, they'll understand that the BO is for oral use. Okay, so again, they're the same description with different wording, insurance terminology wording. Medical wording, enteral, is usually used to describe feeding through a GI tube, but again, with billing, you would use a BO modifier to explain that this is being administered orally. Although enteral formula is more towards dietary supplements, and medical foods are designed for the specific nutritional needs of a particular disease, like PKU or HCU. Cyto B12, for example, Cyto B12 billing code is B4157. This Cyto B12 is a vitamin that you take orally from Solus Nutrition, and the code that's assigned to that is a B4157 code. And that B4157 code starts with enteral formula. So it can sound a little confusing to ones that are not an insurance specialist or a medical biller, but in the eyes of the insurance company and how they relate to things in a service code, they find it completely normal that it fits that type of category. So the B4157 describes enteral formula for special metabolic needs for inherited diseases of the metabolism, hence towards a dietary supplement. So again, service codes are also known as a CPT or HCPCS codes. It is a description of medical services related to HCU, nutritional products, in a numerical alphabetical format, i.e. B4157 and S9435. And your basic insurance words: pre-authorization, a required process by your insurance carrier where your provider obtains approval for reimbursement for your therapy before coverage begins. A predetermination. A predetermination is similar to a pre-authorization, but is a courtesy from the insurance company that bases coverage off of a medical necessity and clinical notes, as well as to prevent any future denials. This also helps save some time for suppliers having to submit additional documentation with a billing claim to your insurance company. So this is how this works. With predetermination, somewhat like a prior authorization where you do have a reference number. Pre-authorization gives you an approval number, letting you know that this was actually reviewed by a medical director, and it is indeed based on medical necessity. Because as a medical biller, when we bill, and we do insurance verification. So insurance verification, if it says it doesn't require prior authorization, we usually ask to see if we can do a predetermination. Not all insurance carriers have that option, because if they say there's no prior authorization required, there's no sense of you doing a predetermination. But if there's a chance of doing a predetermination, that's even better, because two reasons. Why? It will save some time for the supplier submitting additional information with the first claim, showing that it is based on medical necessity. And two, that it would be helpful information to know that this is indeed covered, and this should help prevent any future denials. So both ways, it helps pretty much at the end of the day. It helps to prevent future denials at the end of the day. Next slide. Okay, so I pretty much explained the difference, and I'll go on again. What is the difference between a pre-authorization and predetermination? A pre-authorization is defined as a required process before insurance will cover your services. Preauthorization does not guarantee reimbursement of services. This is all typical with any insurance plan. They always say the same line over and over. If the claim information that is ultimately submitted is perceived to be deficient or misleading. However, the lack of preauthorization usually results in non-reimbursement. Predetermination is similar to preauthorization, as I explained, as it allows services or treatment to be reviewed for medical necessity. In this process, benefit coverage is predetermined before services are rendered, and any limitation under a plan can be addressed before services are provided. A predetermination is a courtesy, where a preauthorization is a requirement under a plan. But I don't want you to get confused that, oh, here's a courtesy. Is actually something that a medical director at your insurance company will review to make sure that it is indeed based on medical necessity to avoid denials. And they'll help you, give you a reference number to use to put on your on the medical biller's claim form. There's a special box there. You would put that number in there to help avoid any type of denials. Next, basic insurance words, fully insured plan, when you pay for your own monthly premium or percentage from your employer, okay? And when an employer or other plan sponsor hires an insurance company to take on the risk of delivering the health benefit. So there are two ways of looking at this fully insured plan, and there's two ways, I believe, looking at it, well, different reasons how to explain the self-funded plan as well. So with fully insured plan, when I call up and I do insurance verification, I always have a box that checks off whether this plan is a self-funded plan or fully insured plan. Why? Because as an insurance biller, I need to know if this is a fully insured plan, and if there's any exclusions, then I could apply an additional state mandate if a mandate is in place, or have the option of working around an exclusion if the plan is indeed fully insured. Then I would ask, what is an insurance? What is a fully insured plan? When speaking with a benefit specialist, and when speaking with a benefit specialist, they had mentioned to me that it's when you pay us for our own insurance companies, pay your own monthly premium or a percentage from your employer. Okay, and that's coming from the insurance benefits area. And then when you're asking your employer what is a fully insured plan, then it's when an employer or other plan sponsor hires an insurance company to take on the risk of delivering the health benefit, basically. Self-funded plan, when your employer pays for your benefit premiums, and when your employer assumes the risk for spending on the health plan, these plans are not covered by state insurance regulations, which means that if I do your insurance verification, they say that you have a self-funded plan, then there's a problem, because if there's an exclusion on that plan, the health plan, like Blue Cross Blue Shield, I'll just throw that out there, they don't have to abide by the state mandate at all. They don't have to abide by it. However, if you ask, do you honor the state mandate, they could actually honor it. So they have a choice whether they want to or not. It's not simply that these plans are not covered at all, period. It's a choice whether they want to remove this exclusion or not, okay, if it's a self-funded plan. And that's when you ask, do you honor a state mandate? I had success in the past where I had asked these questions to the insurance company, and the insurance company indeed honored the state mandate. Then I would do a predetermination if a prior authorization was not required, in adding in that terminology and the benefit specialist name and reference number of the person I spoke to, and include the state mandate. So they can attach the reference number of the person saying that they do honor, even though it's a self-funded plan, and attach the state mandate as well to avoid any denials in the future. So don't be afraid. If you do have a self-funded plan, there could be a chance that they will honor your state mandate. And if not, then we can definitely work with your employer in helping you remove that exclusion. Then you have an ERISA plan, Employee Retirement Income Security Act. It is a federal law that sets minimum standards for most voluntarily established pension, union, and health plans in private industries. It falls under self-funded plan guidelines. And a deductible, an amount of money that needs to be met before your insurance pays. Out-of-pocket max, sometimes confused with deductible. The most you have to pay for covered services in a plan year. It's a dollar amount limit given by your health insurance company. After you spend this amount on deductibles, co-payments, and co-insurance, basically anything out of pocket, your health plan pays 100% of the cost of covered benefits. So if your plan only covers 80%, and you reach that dollar amount limit that they gave you, which is called your out-of-pocket max, then that 80% turns into 100%. So there is a chance of having 100% coverage. The out-of-pocket limit doesn't include your monthly premiums. Well, that's obviously you paying out of pocket for the plan itself, so common sense tells you that wouldn't be allowed. It also doesn't include anything you may spend for services your plan doesn't cover. Does not have to be met before insurance pays their part. Premiums are the amount you contribute each year, each month for the health insurance. So that's something, of course, that you're purchasing out of pocket. Exclusions, items or conditions that are not covered by the general insurance contract. An allowed amount, a maximum amount on which payment is based for covered health care services. This may be called eligible expense, payment allowance, or negotiated rate. If your provider charges more than the allowed amount, you may have to pay the difference. This is mostly for out-of-network providers only. Out-of-network providers are allowed to balance bill. In-network providers are not allowed to balance bill, period. So if you get a bill from an in-network provider that participates with your plan, there's something wrong. Okay, so we'll discuss that balance billing rules in our next slide. Coverage under pharmacy benefits. Trying to get coverage under your pharmacy benefit. Depending on your policy, your medical food could be covered under pharmacy and medical. The best route is to choose the most affordable. It's a common sense way. If you do not have coverage under pharmacy, check your plan if it is fully insured. If so, your plan must abide by the state mandate and grants coverage. State plans or any health group plan should have verbiage for what is covered under pharmacy. So for instance, there's a state plan, and I'll just mention Pennsylvania because I love Pennsylvania. They also exempt co-insurance and deductibles in that law. So, and they also mentioned that if a health plan has both medical and pharmacy benefits, the verbiage in there is plain and clear. So even if you have an exclusion under pharmacy, it's the same way as medical, needs to be removed. Okay, steps to get coverage under pharmacy. Number one, if your state has a state mandate, obtain a copy of that. Then you would submit an authorization to pharmacy management. So you'll first work with pharmacy management and submit an authorization to pharmacy management along with the state mandate. Now, I'm saying you, but in reality, it's your supplier that's doing this, and it's the medical biller that's actually doing this. So whoever's providing you your formula or your vitamins or anything related to your treatment is the one that's responsible for this, okay? So I'm just explaining to you how this works on the back end, so if you ever come across this in the future and you're having issues, you'll know what's happening and you can discuss and work with your members' side of your insurance benefits. So again, you would submit an authorization to pharmacy management along with the state mandate, prescription, a letter of medical necessity, and progress notes. A letter of medical necessity is very important to everything because it's a letter coming straight from your doctor, basically describing the disorder and the important needs of your formula or your medical foods and what happens if it's untreated. And it gives a detailed description of an outline of what's important, what happens if it's untreated, and the description of the medical food itself, and a signature coming directly from your physician. Sometimes a dietitian will also add their signature to that letter of medical necessity as well, because of course the dietitian is who you're working with mostly, and some don't. And then we ask for progress notes, and progress notes are the part of a medical record where healthcare professionals record details to document a patient's clinical status. So I like to submit as much information as possible, especially if you're having to go through a loophole like this to try to get covered, because the more detailed information, the better chances for a successful approval. So if you have more information about your disorder, other medications that you're on in relation to this disorder, your blood levels, your height, weight, BMI, even though no matter what they want to look at that height, weight, BMI, have no idea why, but they love the height, weight, BMI, it must be on there. Sometimes I ask the doctors to add that to their letter of medical necessity. So again, the more information you provide for an exclusion, the better the chances of a successful approval. Then you would, the first attempt, you will get denied. You will always get denied. So wait for that denial. Then submit to the appeals department along with a cover letter appealing the denial, the state mandate, the prescription, letter of medical necessity, and clinical notes. So when I say clinical notes and then I'm saying progress notes, it's the same thing pretty much. It's still in relation to the same detailed document of patient's clinical status. Sometimes a clinical note could just be a consultation of when the patient went into the office and gave a brief consultation of what was serviced that day and whatnot. Progress notes could be a little bit more in detail of following up after the consultation. I hope this makes more sense. So again, you would submit that to the appeals department. And then the appeals department comes from the medical group of your insurer, which is considered under your medical benefits. So, and they, from your medical group, part of the benefits, makes the final decision on what is coverage under pharmacy. So how that works is you would get a denial, you submit it to the appeals department. The appeals department goes straight to their medical benefits portion. They would then decide whether or not if this could be covered, and the final decision is made under the medical benefits, and they overturn the authorization to your pharmacy benefits. So it's overturned. Typically, it's going to be covered under medical, but because you're fighting it under pharmacy, then they would overturn it and have the approval available for pharmacy. And then you'll get an authorization number, and pharmacy will be able to bill under an NDC number, billing NDC number. The difference between medical benefits versus pharmacy, again, medical benefits for enteral formula medical foods use a HCPCS code, which is the B or the S code. Suppliers are DME or home infusion suppliers, specialty suppliers sometimes. Pharmacy benefits uses an NDC, which is in relation to the product itself alone. It's codes to identify a particular nutritional product, not a medical service, such as a HCPCS code. Suppliers are CVS Pharmacy, Walgreens. Medical benefits for hydrocobalamin ML use HCPCS code J3420, and for pharmacy benefits, it is under an NDC number. This code, J3420, is used when injected at the physician's office. It is usually covered under medical. So if you have to take these vitamin B12 shots, it's best to try to get that administered in your physician's office to have it covered under your medical benefits. But if you can get it covered under your pharmacy benefits, then that's fine as well. Okay, all right. The treatment of cobalamin defects requires vitamin B12 injections, such as the hydrocobalamin ML. The health insurance benefits for the hydrocobalamin ML for cobalamin defects typically fall under the medical benefits since the skin is pinched or broken, such as with an injection, and the place of service, such as the clinic. If your clinic could purchase these products, administer, and bill your insurance company, it would be the best affordable route, especially if you just don't have coverage under your pharmacy plan for this. Some pharmacy benefits do not cover these products and consider over-the-counter. To obtain coverage, it requires jumping through loopholes again. If you have a health savings account in relation to your insurance plan, that may help with deductibles or coverage for your over-the-counter medications and whatnot. Over-the-counter, which is OTC, that's an abbreviation. If you see OTC there, products are often covered with a health savings account or on your own. Other possible suppliers are compounding pharmacies, specialty pharmacies, or home infusion. The dietary treatment for the classical HCU requires medical foods such as formula and solid low-protein foods, which is Ominex 1 HCU gel. The health insurance benefits for products used to treat classical HCU typically fall under the medical benefits, since the treatments are administered at home and are not considered prescription drugs. There are some HCU products covered under pharmacy benefit, but most are considered over-the-counter and require jumping through loopholes. We will discuss pharmacy coverage in our upcoming slide. Okay, products covered for HCU dietary treatments. Now, I know that some of you don't have your screen open, so I'm just going to read off some of the formula and vitamins and low-protein foods. Just bear with me. So there are products covered for HCU dietary treatments, which are formula, the vitamins, and low-protein diet. Sometimes you have an HCU that doesn't even require vitamins at all, which I met someone at the HCU Network of America, and she was telling me that she doesn't even need any vitamins for her case, but every case is different. But typically, it's the formula, vitamins, and low-protein food diet. So there are medical billing HCPCS codes and NDC billing codes related to these formulas that are used for billing your insurance company. And they could often be covered under your medical and pharmacy benefits, okay? So I'm just going to read off some. It's probably not all, but just to give you an idea. So you have HCY to child to adult medical food for homocystinuria by Mead Johnson. Their medical billing code is B4157 or B4162. B4157 is the typical enteral formula nutritionally complete for special metabolic needs. And B4162 is an exact same thing, but it's just for pediatrics. It just adds the word pediatrics in there in the service code. Is this covered? This is covered under medical and pharmacy benefits. Homocystinuria 1 Amino Acid Modified Infant Formula with Iron from Abbott. That code is B4162 because it's an infant formula, and the B4162 points out that it's a pediatric service for enteral formula. Again, that's covered under medical and pharmacy benefits. If it's being fed via oral, if it's being fed orally, then the medical biller would add a BO modifier describing that this is being administered orally. You have Homocystinuria 2, which is not the infant formula, but then you can use either the B4157 or B4162. You have the HCU Animix next. Same codes, B4157 or B4162, covered under medical and pharmacy benefits. HCU Cooler Nutritia, B4157 or B4162, medical and pharmacy benefits. HCU Gel by VitaFlow is B4162. It appears to be that this is a pediatric formula, and this is also covered under medical and pharmacy benefits. When I mean covered, I don't mean it's guaranteed coverage. Just please keep in mind that you don't get confused when I say it's covered by medical and pharmacy benefits. Again, nothing is a guarantee of benefit or coverage. It's just about making sure that you get it covered the right way by using the appropriate codes and diagnosis codes and clinical documentation. So we have Cysteine 500, which is just a supplement. It's a single-dose amino acid supplement, and they use the code B4155, and that could be covered under medical and pharmacy benefits. Pharmacy benefits would, under that, it's basically, they're describing this as an enteral formula, but in reality, it is, it's just a formula type of supplement in a powder format. That's how it's looked at. Again, it's B4155, medical and pharmacy benefits. Then you have homocysteine AA plus berry, Cambrook Therapeutics, B4157, B4162 covered. Cysteine, sorry about that, which is a powder. They have a specialty pharmacy called Anovo. This is only under pharmacy benefits at this point. There's no HCPCS codes assigned to this product at all. But by looking at the product, it is indeed a powder format for the treatment of HCU, which could be a possibility of having this covered under medical benefit and being dispensed by a DME supplier versus a specialty pharmacy. But because they don't have any type of medical billing codes assigned, there's really not a chance yet to have this covered under medical benefits. So for that reason, it's just covered under pharmacy benefits. Then
hey,
you
Raenette,
have,
Raenette, can you hear me?
Yep.
Raenette?
Yep.
Yeah, so it's Margie. Let me just stop and ask a question about Cystidane.
Okay.
It was my understanding that the company that markets this in the U.S., which is called Recordati, has chosen Anovo as the only distributor.
Oh.
So as far as I know, at this point in time, it's not even possible to order it elsewhere. Danae has a good relationship with them, so she may know more. But I'm curious, have you heard any issues from HCU families about difficulty in getting reimbursement for Cystidane?
Actually, I haven't had one case that asked for reimbursement coverage yet for that product.
Okay. Well, hopefully that means it's being covered as a pharmacy benefit.
Hopefully.
Can I speak up?
Sure.
Yes.
Yeah. It is, well, as far as Jason, he has been covered through the pharmacy benefits, and it's covered by Anovo, and we only get charged a minimum amount every quarter.
Good. That's great.
That's right.
So,
wonderful.
They really do work with you to be able to provide you the best coverage.
That's good. Yeah, and that's one of the reasons companies like that will choose one specialty pharmacy, because then they become expert in how to get reimbursement. So, you know, hopefully that experience will play out with others, that it is a covered benefit.
Same here. Okay. All right. Then we can skip down now to vitamins. So you have the, again, the hydrocobalamin MLB12 injections. And we just learned that it could be covered under medical and pharmacy benefits. So they would use an 11-digit NDC billing code and a HCPCS J code to administer that in the office if they could, and have it to be billed under medical benefits. You have the Cyto B12, which is a liquid. It can be consumed orally or tube feeding, and this is with Solus Nutrition. I don't know if anybody's ever heard of this yet with Solus, but I'm pretty excited about this. That also could be billed under medical and pharmacy benefits. Right now, they have an assigned medical billing code B4157, and that's a great code to use for that. And I know for sure that people are getting the Cyto B12 covered through EdgePark and Quorum. So that's another avenue that maybe physicians could take a look at. Another is the B6 injection solution, and that's, again, the same as the hydrocobalamin B12, which is the NDC code and the J code. And then you have the vitamin B9 if needed, and that's either tablet or injection. And again, I think the folic acid, I haven't really worked with anyone asking for reimbursement support for that. But at this time, if it is indeed an injection, it could be the doctor's office could use the J code and administer it in the physician's office. But I don't see a billing code or an NDC billing code for vitamin B12. So I'm really thinking B9. I'm sorry. That I'm thinking that could be an over-the-counter. So again, I'm not too familiar, but it is in line with what the products are needed for HCU dietary treatments. And lastly, it's solid low-protein foods, and that's a medical benefit only. And those codes are S9434 or S9435. All right. That was a long one. That was a really long one. But I know some people don't have they don't have the option to.
Raenette, do you just want to ask if anyone on the call has any questions on that?
Does anyone have questions at this point? Hello?
Great. Okay, let's keep going. Thank you.
Okay. All right. So receiving bills from your supplier can be scary, right? So don't panic. First, make sure if you received a bill from your supplier, or is it an EOB statement from your insurance company? An EOB statement, which is the explanation of benefits, is from your insurance carrier. It's not a bill. It is an itemized statement of what is covered and what is not. You will receive an EOB after your provider submits a claim to your insurance carrier. If you don't receive your EOB, request it from your insurance carrier. Let's see. If you received an EOB statement and notice that there is a balance due, it could be that you haven't met your annual deductible and will need to pay for your formula up front until your deductible is met. Check your EOB, usually listed on the bottom page, or contact your insurance carrier to confirm if your deductible is met. Or the balance could be your coinsurance of let's say, 20%. If you met your deductible or if it's not clear why you're being charged, contact your supplier to go over your EOB statement. It's best to work it out with your supplier to avoid any future bills and to help alleviate possible frustrations. All participating, as known as in-network suppliers, must not balance bill their customers, and they have to accept allowable amounts from the insurance carriers. In this case, you should only be paying your co-payment amount, if any, or any annual deductibles that are due. Non-participating providers, also known as out-of-network, are indeed allowed to balance bill, okay, because they're not contracted with your insurance plan. So that means that if they charge more than the allowable amount from your insurance company, then you are responsible for the remaining balance. If you notice your balance due is unusually high, contact your supplier and ask to go through the claims or the invoices that were sent to your insurance carriers, just to make sure they submitted the right amount and right billing codes. Billing discrepancies is usually a cost versus reimbursement problem between your supplier and your insurance company. Supplier companies are responsible for billing customers' insurance carriers. If not done correctly, the supplier could get confused and send a bill to you for non-covered services. First, it always depends on the person's working on the claim from the supplier's billing department. Always, always. It's always the person. Suppliers usually do the insurance verification should be done first before providing the customer's product. If verified as covered and you still get a bill, then there was a communication problem between the person working on the claim and the insurance company. Once verified as covered, the suppliers need to fight with the insurance carriers for payment and not send a bill to the customer. And then if they don't get anywhere, they'll try to pass it off to the patient and say, well, you know, we tried our end, now it's you need to try. This will happen. If one is not experienced enough with insurance terminology or medical billing, this process can become very difficult for the customer and the billing person at the supplier company. Should a billing discrepancy get out of hand, do not attempt to handle this on your own. It can be very confusing. You can start adding up a lot of bills, and it can get pretty scary. Contact an insurance specialist or a medical biller that is experienced with these situations. Usually you can contact the medical food manufacturing company. They usually have insurance navigators in-house. They'll be more than happy to help you with their products. Or you can contact me directly, which is Raenette Franco, CBCS at Compassion Works Medical, 973-832-4736. Or you can email me at rainettef@compassionworksmrs.com. Now, if you're having complaints with your insurance plans, if you're experiencing many problems with your primary insurance carrier, such as coverage and reimbursement, you may want to opt out of your primary health plan and into another health plan with better benefits. This is something similar to your situation, Francis. Mm-hmm. You could also add a secondary insurance plan that will help with any costs that your primary will not cover. Finding health insurance carriers. If you decide to opt out of your current health insurance carrier and or add a secondary insurance carrier, please go to the below websites to find benefit comparisons with various carriers within your zip codes, which is www.healthcare.gov or www.ehealthinsurance.gov. Healthcare.gov is also known as the marketplace. They require you to set up an application first before choosing a plan, and they set you up with this email, and you have to confirm your email, all that. Then you can go ahead and choose a plan. Complaints with insurance plans, exclusions. If you have an exclusion on your plan, like medical foods are not covered, don't take no for an answer. Don't take no for an answer, because there's always a way or some way that's there's some type of miscommunication somewhere. Contact your health plan and ask to file complaint against coverage for your medical food. Yes, you can do that, and yes, I've experienced successful outcomes that way. My members just fighting on their own and filing a complaint against the coverage for that. If you have a fully insured plan, find your state mandate to help remove the exclusion and submit to your insurance carrier. Some states exempt coinsurance and deductibles, such as Pennsylvania. To help find your state mandate, go to the National PKU Alliance, which is npkua.org/take, and then you have a /action/state-coverage. Okay, so basically you can just go to nationalpkua.org, and you could look for state coverage, and you can find that coverage there. Even though it's for PKU, it still lists for other rare diseases such as HCU. If you don't have a fully insured plan and have a self-funded ERISA plan, ask your insurance carrier if they honor state mandates. This is what I mentioned earlier. Just ask if they can honor the state mandate. If so, submit your state mandate to your insurance carrier. If not, work with your employer's human resource department to help remove the exclusion. Another option, again, is to opt out of your current health plan or add a secondary health plan to help pick up what your primary will not cover. This will be discussed more. Stay tuned. Medical food exclusion removals from employers. Now we pass this. It's a self-funded plan. They're not honoring any state mandates. There's just no way of coverage with that insurance plan, Blue Cross Blue Shield, let's say. So now we have to work directly with your human resource department and find out if they could help remove this medical food exclusion based on medical necessity. Usually your exclusion comes from your employer's contracted plan with your insurance company. You will have to present a letter of medical necessity and a medical food exclusion removal request letter to your human resource department for assistance. For federal and state plans, exclusion removals are a bit complex. You should seek assistance from a certified insurance advocate for federal or state health plans that are giving you a little bit more trouble trying to remove an exclusion. For a template letter of medical food exclusion removal, you can contact me directly at raenette@compassionworksmrs.com. I'll be more than happy to send you a template letter that will need to be filled out by your physician and signed by your physician and presented to your human resource department. It's better to carry this letter with you to your insurance, to your human resource department. So in this way, it's easier for them to understand exactly why this needs to be removed for medical foods, and they have everything in writing. They can have this set up in your record, in your employee record, as to why they needed to help remove this medical food exclusion removal. If you try to explain the reason why my son has HCU and explain HCU, it would probably go through one ear and out the other because they're not clinical experts, and they just probably won't even get it why medical foods are so important, or even dietary supplements. So it's best to have a medical food exclusion removal letter and a letter of medical necessity from your doctor. Any questions?
That was quite a mouthful, Raenette. Thank you.
It sure is.
Open it up to the others we have on the call. Does anyone have any questions for Raenette?
I have a question, but it's not about foods or formula. It's about getting reimbursement for the chemistry, the labs, for HCU, and Jason, we've always been reimbursed for his lab work for at least 20 years now. Mm-hmm. And then this past couple of months, I keep on getting statements from Quest saying that it's been denied, and these are almost $1,000 bills for lab work. And so when I called Blue Cross Blue Shield, they said it was a coding error. What do you suggest I do? Because I'm ready just to pay the balance. So
no. If it's a coding error, that means that whoever billed the service entered in the wrong service code. Uh-huh. So it's a particular service code that is used for the labs, and whoever did that work put in the wrong service code. So your service code has to match the diagnosis code that's being used as to why your son needs to get these labs, and if it doesn't match, it's going to come back denied. So I would advise you to contact your insurance company and let them know the services with LabCorp, and try to find out what service code was incorrect so you can mention that to LabCorp.
Yeah, Raenette, aren't they obligated to give you as the enrollee the right service code so that she could then go to the provider who did the test and get it fixed?
No.
I did contact the doctor's office asking them to send it in with a
But call the insurance company. Call and speak to your members, the members' benefit side, and let them know that you've always been covered, but you received this denial, and it appears to be the wrong billing code, and they should be able to help you directly. They should be able to do that by looking at your old claims and comparing the codes that were used from your old claims to the one that's been denied, and maybe that could help you that way.
Okay. Yeah, I would explicitly ask them to give you the code that should have been used. I know I've done that with other non-HCU related issues, and my Blue Cross plan has given me that code.
They told me they weren't allowed to do that.
Who said?
Really?
And that they were even violating protocol by telling me that it was a coding error.
Wow.
That's company protocol.
Is that what the insurance company said to you?
Yeah, Blue Cross Blue Shield of Massachusetts.
Okay, so you know what? You need to speak with your provider, which is the LabCorp. Providers then are capable of obtaining that information because they're the ones that are billing for the service.
Okay.
So they're basically responsible for that. So
yeah, and Raenette, this is related to the issue I brought up before the call began. So as background, if someone gets a homocysteine test done and they don't have HCU, it's considered experimental because homocysteine is not an established risk factor for the general population. So I actually had a claim rejected for $180 because having had two sisters who I lost from the disease, I wanted to know what my homocysteine level was, even though I don't have the disease. But just in case I could be a carrier, I wanted to know that. And what I found out in the process was if they think that you're just the general population, it's considered experimental and they won't cover it. So somehow LabCorp has to include coding that shows that your son is a patient with homocystinuria.
Yes.
Therefore, they should consider it a necessary test to monitor his ongoing progress.
Does that make sense? Does that help you? Okay. Okay,
yeah,
good.
And follow up with Raenette if it doesn't, because I'm sure she can help you to solve it.
Yes. Yes, if you have any more issues. All right.
Other questions on the call? Raenette, maybe I'll ask one. Danae, unfortunately, had technical issues after she spent half the day in the hospital, but she's not having her baby yet, but they have to make sure. But anyway, I told her I'd ask a follow-up question. So I know you've dealt with several families with homocystinuria and helped them solve their issues. Can you just share some of the things that you've addressed and what the issue has been and what the outcome was?
Okay. Well, pretty much, again, HCU is all related to almost other conditions that require medical foods or low-protein foods. So basically, when people come to me, it's usually a complex case in which that, let's say, they have an exclusion on their plan or they're denied coverage for their formula. Okay. What my experience was, they try to work with their insurance navigator at their medical food manufacturing company, and there's a bump in the road. There's just no coverage. There's some type of exclusion somewhere, and it's just they can't find the exclusion. Sometimes when with your insurance benefit, you need there's certain types of coverage, which is called diagnosis-driven coverage, which means that if you're asking for coverage for medical foods or enteral formula or using the service code B4157 or S9435 to get a better description, and they say it's just not covered, then you may want to ask if it's diagnosis-driven coverage, which means that they have a list of diagnosis codes that would match that service code. And if it matches, then it would be covered as a diagnosis-driven code. So I've been successful at helping people understand the difference between diagnosis-driven coverage, types of different plans, and how it works. So there's been issues where people just felt that they weren't covered, and they were the whole time, just didn't understand the concept of a diagnosis-driven coverage. Then you have like Frances here. I'm going to help her son. Frances?
Yes, hi.
Do you mind if I just tell them a little bit about what we're doing?
That's great. Go right ahead.
Okay. So Frances, been working with Frances and her son for a while now, and they reached out to me through the National PKU Alliance, but now you have the HCU Network of America. Woohoo, Frances. So no more there. You don't have to go to National PKU now. Anyhow, Frances reached out to me because her son, Jason, has HCU and is living outside of the home, and he requires certain special medications as well, and he's been on his parents' plan for many years, not knowing that there's a possibility of him obtaining a different coverage. So right now he has Medicare, and he doesn't have Medicaid, but he has Medicare, a disability Medicare plan. So what I'm trying to do for this family is to help them get off of the straight Medicare, because Medicare does not cover formula unless it's fed through a feeding tube. That's how that works. So if I get this patient onto a managed Medicare plan, okay, that would be like a plan that would be managed by another company, such as Aetna or Highmark or some other company it's managed. They're more lenient with coverage than having a straight state Medicare plan. I've been successful helping patients switch off of their straight Medicare plan and jump into a managed Medicare plan for coverage for their medical foods. So this is what I'm doing now for Jason, Frances' son. At this point, we're going to help. Go ahead, Frances.
No, I was going to say I'm just so grateful to have you doing this.
Oh, you're welcome. You're welcome. And he's been on his parents' plan for many years. It's been extremely expensive for them. And now they have the opportunity to hopefully switch off of that plan, get into a managed plan, and stop having to pay all this money for their son.
Great. That's great to hear. Good luck.
Thank you. Any other questions?
Well, great. Well, thanks, Raenette.
You're welcome.
Those of all appreciated it, and we did some technical issues that I'm sure prevented some from calling in, but one of the great benefits of these webinars is we then can, we've recorded this entire webinar, and it can then be posted to our YouTube channel, so all of the members of the HCU community can listen to it convenience. So thanks for everything you're doing to help the HCU community. It's so meaningful because we all want to make sure that every person who needs, benefits of this treatment and the medical foods and supplements is able to get them and not incur a financial hardship. So thanks for everything you're doing to support our community.
Thank you. You're welcome. It's very rewarding, and I'm always here. If anyone has questions, gets stuck in a situation with coverage, I always say don't take no for an answer. Just never, ever take no for an answer. And if there's something that you can't fix on your own or your insurance navigator for some reason can't fix, please feel free to give me a call. I'll be happy to do whatever I can to help.
Yeah, and let me just add that Renee is a contractor or under contract with HCU Network America, so we're supporting, the provision of these services to the community. So don't worry that there's going to be a big bill to help you get your coverage. It's on us. Really all part of helping the community. So thank you,
HCU Network of America.
Okay, good night, everyone.
Thank you both.
Good night.
Good night, everybody.
Bye-bye.
RTA,